Hey guys, welcome to my YouTube channel. My name is Nurse Lalies and I'm back with another video for you guys. I'm doing a sit down today, which I haven't done in a while. I feel like every time when I start my videos, I'm always like, I'm doing this today and haven't done it in a while. But yeah, anyways, so I haven't done a sit down in a long time because it's been Vlogtober. So I've been releasing a lot of vlogs in the past month. Yeah, so now we've reached the end of Vlogtober and it's a new month and I'm back to my old content. So I am so impressed on how consistent I was during Vlogtober, and I really hope, and I'm gonna try really hard to ensure that I am consistent even now that it's not Vlogtober anymore. I want to come back with my sit down content and I want to bring a lot of new content. So yeah, that's the plan. But today I'm doing a sit down for you guys and I am talking about why yes you, if you are pregnant or you're planning on getting pregnant in the future, why should you get a midwife for your pregnancy journey? So yeah, that's what we'll be talking about today, the benefits of having a midwife for you throughout your pregnancy, and we're gonna unpack everything. So yeah guys, I hope you guys are going to enjoy this video, and if you do, please give it a thumbs up, please subscribe to my channel and click on the notification bell, and please don't forget to share this video with other women so that they can also benefit from it too. So without any further ado, let's get on with this video. Okay guys, so before we go any further with this video, let me just make a disclaimer. You can have a midwife as your primary health caregiver during your pregnancy only if you are low risk. Okay, you can only have a midwife throughout your pregnancy as your primary caregiver if you are having a low risk pregnancy. And who are the people that are having low risk pregnancies? Those are people who don't have any medical conditions like asthma, epilepsy, heart disease, diabetes, or high blood pressure. It's anyone who is probably in their first pregnancy, they're having their first child and they're still very young, below the age of 35. And anyone who hasn't had a previous surgical procedure to deliver their baby. For example, you haven't had a cesarean section. So that's basically someone who's like still young, maybe in their 20s, it's their first pregnancy and they have no medical conditions that they are taking any treatment for whatsoever. So that is someone who is low risk and they would be having a low risk pregnancy. So you can only have a midwife as your primary caregiver if you are having a low risk pregnancy. Whenever you are a high risk pregnancy, let's say you are above the age of 37, you are 38, and you've had a cesarean section before and you are hypertensive, you have high blood pressure, then you are a high risk. You are no longer a low risk pregnancy and therefore you cannot see a midwife throughout your pregnancy. You need to be seen by a gynecologist throughout your pregnancy, and most likely you will probably need to have give birth with a cesarean section. So all of that spells high risk. Okay, so I'm talking about people who are low risk. Such people can definitely have a midwife throughout their whole pregnancy, at their labor and delivery, and post-birth. So those are the people that I am talking about in this video. I just needed to clarify that so that we are all on the same page, because not everyone can be seen by a midwife throughout their pregnancy. Other cases are for a gynae, but if you are low risk, there's definitely no reason for you not to use a midwife. Okay, so now that we've gotten that out of the way, let me give you the 10 let me give you the 10 reasons why you should have a midwife with you throughout your pregnancy, or why you should choose a midwife to be your primary caregiver during your pregnancy. So yeah, let's get into it. Okay, so the first reason, a midwife will be with you throughout your pregnancy, right? From the time that you discover that you are pregnant and you decide to go and book your pregnancy. So a booking visit is that very first visit that you will have with your midwife. And like so many things will be done, your bloods will be taken and all of that. Your midwife will be with you from that booking visit, and that booking visit can be as early as when you're around like 8 weeks pregnant, or some people will start attending with their midwife when they're like 12 weeks. Yeah, so it's from the beginning of your pregnancy throughout your pregnancy and up until you deliver your baby. Your midwife will deliver your baby with you, and even after you give birth, your midwife will still see you for the first few days after you give birth, and a few weeks after that your midwife can also continue with you. So can you see that this is such a long relationship that you will have with one person, and you're going to develop a relationship built on trust, because you're going to get to know each other throughout this time. I mean, like, a pregnancy is like 10 months, and you'll be with this one person throughout your whole pregnancy. So you're really going to develop a relationship with them. You're going to get to know them, they're going to get to know you. There will be that trust that's established with each other. I mean, the more you interact with your midwife and she helps you with a lot of things throughout your pregnancy, you're going to end up trusting her, and you're just going to have that relationship, which is such an amazing thing, because when you go and you deliver, now when it's time for you to give birth to your baby and you're going through that very stressful period, at least you know that you have someone who's been with you throughout your pregnancy, and you know and trust this person to take you through your labor, which is something that might be like very, very stressful. It might be a very stressful and very difficult event. But if you have the right support system, if you have a good midwife, you'll be able to go throughout that whole process with so much ease. So it's such a beautiful thing that you can have one person that you have to deal with throughout your whole pregnancy. So a midwife is qualified to be able to take you throughout your pregnancy. Now, obviously, you still need to be seen by a gynae, maybe like for a few visits, maybe 2 or 3 visits you will have with a gynae, just so that a gynae can make sure everything is fine. And you will have some few visits with a sonographer as well, who can be able to do like your scans and detect things like your gender, the gender of the baby, how far you are in your pregnancy. But ultimately your primary caregiver will be your midwife, and that's the person that you're going to see throughout your pregnancy. That's the person that's going to deliver your baby if everything goes well and there are no complications. And that's the person that's going to see you and your baby in the first few days after you give birth, and 6 weeks after you give birth. Your midwife, if she does provide the service, can also do a pap smear for you after you give birth at 6 weeks. And your midwife can also give you family planning, your contraceptives, or if you're going to start your contraceptives with a gynae, and then your midwife can like continue if she is providing that service. So yeah, guys, it's actually such an amazing thing to have a midwife. So that is the first reason why you should get a midwife or choose a midwife for your pregnancy journey. And then the second reason why you should choose a midwife to be your primary caregiver throughout your pregnancy, your midwife will spend time with you during your consultations. So for example, the first consultation, which I call the booking visit, it's quite long. It usually takes about an hour, because we need to get your history, we need to get to know you, your medical history, the kind of operations that you've had, any medications that you are taking, or medications or diseases that are in your family and get to know your lifestyle history, everything. And we need to take your blood, and then we need to do a physical exam. So there's a lot that happens in that first visit. And you can get some information as well about your pregnancy and be told some of the things that you can expect throughout the pregnancy and some danger signs to look out for. And in that visit, you can also have a chance to ask like all of the questions that you have with regards to pregnancy. If there's anything that you want to clarify, you have that opportunity to do that. So that consultation is quite long, a whole hour, and all of that will be done. And by the time you're done, you will feel like you are so ready for the whole pregnancy journey, especially if it's like your first pregnancy. But yeah, your midwife will spend that time with you during your consultations, and also even your follow-up visits or consultations with your midwife. They'll be about like 30 to 45 minutes long as well. And whatever problems that you are having as your pregnancy progresses, you have someone who can answer all of your questions and literally give you that attention and allow you to express your feelings and your concerns and answer all of your questions. So like, who wouldn't want that? You know, who wouldn't want that? Someone who's just gonna pay so much attention to you. And that's what a midwife does for you. And then another thing, when you come to your consultations, you can bring your partner along, you can bring your mother, you can bring your sister, or whoever you feel comfortable bringing. You can bring them to your consultations with your midwife. They might also have some questions, and all of those can be answered as well. So it's a really nice and cool thing actually to have a midwife. And the third reason why you should choose a midwife as your primary caregiver throughout your pregnancy, a midwife will give you quality care that is evidence-based. So midwives really try their best to search out the most current research and search out the most current ways of doing things. So as we know, like research it's done like all of the time on things in the medical field, and new information is learned and new concepts are learned, and the nursing care that is given, it's constantly revised and constantly refined. So I mean, we don't have to work on guidelines that were brought out in 2010 and now it's 2022. We need to go forward with the times. So we need to know the latest research, how things should be done, what things should we no longer do in our practice. So yeah, midwives these days are well informed about current research and newer ways of doing things and using the latest advanced technology to take care of you. So you can be sure that if you get an independent midwife, you have someone who is constantly upbuilding themselves and their skills so that they can provide a better service for you. The fourth reason why you should get a midwife to be a primary caregiver throughout your pregnancy, with a midwife you get affordable care, quality care, evidence-based practice that is affordable. It is literally so affordable to get a midwife for you through your birth that you don't even need medical aid for it. You just need to save. If you plan properly for your pregnancy and you just save up, you can get a private midwife and you can get private quality care without having medical aid. And even if maybe your pregnancy was like unplanned and your baby just was an oopsie baby, you can still have a midwife, because the fees that the midwife will charge you, they don't need to be paid upfront. So you can work out a payment plan with your midwife, because some midwives have like a global fee, and that global fee it includes like everything that you're going to need throughout your pregnancy. It covers your birth, it covers your antenatal consultations, it covers your sonographer fees, it covers like everything Or some midwives, it will cover the birth and the antenatal consultations, and then anything outside of your midwife fees, like your visits to the sonographer for a sono or your visits to the gynae, then those ones will be like a separate cost. But then with your midwife, you can have like all of the costs, including all of the bloods that you need for your whole pregnancy. So it's affordable care. Midwives usually charge for the antenatal consultations around like 400, 500, 600. I've seen like 600 round about there for some practices when it comes to like the booking visit. And then usually the follow-up visits are less than the booking visit because not as much is done during the follow-up visit. So, but yeah, anything from 400 to 600 for one consultation, and that is like really affordable when you look at the actual prices of consultations these days. Even for doctors, they are so expensive, guys. Like a consultation with just a GP is like around 600 and something currently, and probably you're gonna be there with the doctor for like 15 to 20 minutes, if it's even gonna take that long. But as I said, with your midwife, you're literally gonna spend nothing less than an hour for your first visit and 30 to 45 minutes for your follow-up visit. So it's actually quite an affordable price for the amount of time that you are going to spend with your midwife and the amount of effort that's going to be put into your consultation. So that's really affordable. And then when it comes to like the delivery fees, some midwives cost or charge anything from around like 10,000, between 10,000 and 15,000. So that's also very much affordable because, guys, there's like such a huge benefit of having a midwife with you throughout your labor and delivery. That midwife is going to be with you throughout your delivery, and that's amazing. That's really amazing. She will be focused on you. So when you have a private midwife or a private independent midwife, actually, it's not like in government whereby the midwife will be taking care of maybe 4 patients at a time or 4 pregnant mummies at a time who are all in labor, and then she has to divide her attention with so many people. So when you have a private independent midwife, that midwife is going to be focused on you throughout the whole time you are in labor. Before you go to the hospital, you'll be constantly in communication with your midwife, and then by the time she says, okay, no, we need to go to the hospital now, she's going to stay with you up until you deliver your baby. And even after you deliver your baby, she's still going to stay with you for some time to ensure that everything is okay with you. So literally that 10,000 or 12,000 or 15,000 that you're going to pay for your midwife, it will be worth your every coin, because your midwife is going to be with you throughout that whole time, literally that whole time. So that's like really amazing, because again, when you're going through that very much difficult period, you have your trained midwife to take you throughout the whole process and make sure everything is going well, and give you emotional support you physically, and in every way possible, guys. Like, a midwife is just going to be there for you throughout everything. So yeah, I really think that midwives are really so affordable. And the nice thing about how affordable their fees are is that you don't even need medical aid. So that's quite amazing, guys. Like, that's really amazing. And then the 5th reason why you should get a midwife as your primary caregiver, you get 24-hour access to your midwife during via calls or via text messaging. Now, obviously, guys, you're not gonna message your midwife at 12 o'clock at night for something that really can wait till the morning. Okay, we obviously need to try and respect people's family time, people's personal time, But during office hours, you can contact your midwife at any time, unless you having something that might be an emergency, and your midwife will give you information about how to detect emergencies in your pregnancy. So you will know exactly when you need to call your midwife or text your midwife outside of working hours. So that's very nice, because then if you're having things happening to you and you just don't understand and you think that you know what, something might be happening, actually I might be having a danger sign or whatever that you're not sure of but could be really serious, you can just take your phone and call your midwife or text your midwife, and she will respond to you as soon as she can and give you the information on what you should do to manage the situation. So that's really reassuring. It's like so reassuring, because a lot of moms, especially if it's like your first pregnancy, there's a lot that's happening or that's going on and you don't know what to feel, you don't know what's normal, and just having that person who's trained and qualified and knows about pregnancy, and having that person and you can contact them at any time, that's so amazing, because it can really allay your fears or just reassure you, give you that reassurance that everything is okay. Or if it's something that needs to be investigated, then you know that you have your midwife who will be ready to act to just ensure that everything is going well with your pregnancy at any time. How amazing! Okay, then the sixth reason why you should choose a midwife as your primary caregiver is because your midwife will be with you throughout your whole labor and delivery, and your midwife will be working with a doula, most likely. Doulas are people that give women a lot of emotional support when they are in labor, and then they also help them to do exercises, physical activities and exercises that can help the labor to progress more quickly. So having a midwife is different with having a gynae. A gynae, if you are admitted into hospital and you're in labor, a gynae will just come every now and then to check on you and ensure that everything is going fine. And then when you are ready to deliver, they will also come. But the person who will be with you primarily throughout the whole thing, even when you are in hospital and you don't have an independent midwife, it will be the in-hospital midwife that will be with you. So that's the nice thing about having a midwife, that your midwife will constantly be there. Of course, she's going to need to maybe go and write some notes and document the progress of your labor, but mostly she's going to be with you, supporting you, and doing everything to just give you and your partner or whoever your labor support person is all the support that you need. So your midwife is just going to be there. And if you have a gynae, he's not going to be there throughout the whole time you're in labor, because obviously gynaes are busy, they have other patients to attend to, and they're constantly sometimes doing cesarean sections. But your midwife, if you're in labor, she's going to be with you and she will be focused with you the whole time, literally. So that's great, like that's amazing. And the seventh reason why you should choose a midwife as your primary caregiver, it's because your midwife wants to help you as much as is possible, to help you deliver naturally, to help you give birth through a vaginal birth, right? Midwives are all about natural delivery. And when you think about it, that's the normal way of delivering. A cesarean section is not a normal way of delivering. It comes into place when there are complications or when there are issues and we need to act, because we cannot wait for the body to go into labor. But obviously we know nowadays that a lot of people do elective cesarean sections, so they just choose to do cesarean sections without any complications being present, just because that's what they prefer. But if you want to have a natural delivery, a midwife is your best bet to give you like the best attempt at it. Your midwife will try everything in the book to try and get you to deliver naturally. Only if things are really not working out and things are really just going wrong, then your midwife will have a backup gynecologist who can be ready to do a cesarean section if there is a need to do so. But midwives are all for natural birth. We believe in natural birth. We believe in the woman's ability to give birth naturally. So we are pro natural birth, and we'll do everything that is in our power to help you to deliver naturally. So if you choose a midwife to be with you and you know that you want to deliver naturally, you can rest assured that your midwife is going to try everything in her power to help you to deliver naturally. And that can just like ease your fears, you know, that can just put you at rest that, you know what, you can give it an honest try. And obviously, you know what, if complications arise and things don't happen the way that we plan, of which sometimes that's a reality of life, things do happen that way, it's also okay if you end up having to have a cesarean section. At the end of the day, what's most important is that you give birth to your baby and your baby is healthy. But yeah, if you really want a natural birth and you want someone who's going to give it an honest try, midwife is your best bet. And also your midwife, because she's pro-natural, she's going to try all that she can to ensure that you give birth in a way that is as natural as possible. Meaning that there are no unnecessary interventions that are done to you to try and speed up your labor, to try and make you give birth quickly. You can choose to have a natural unmedicated birth and no interference from the midwife, like breaking your waters before the body actually does it itself. And with the midwife, there won't be like continuous monitoring of your baby's heart rate, like putting you on the CTG machine the whole time that you can't even move around. Your midwife will want you to move around, do certain exercises to help the baby's head go down, and your midwife will let you deliver in different positions. You squatting, you kneeling, and all sorts of positions that feel comfortable to you. So your midwife-led birth will be free of unnecessary medical interventions, and we'll just listen to your body and make sure that everything is going well. And then the 8th reason why you should choose a midwife as your primary caregiver is that your midwife will be on the lookout for any complications while you are in labor, and even throughout your pregnancy. Your midwife will be that like watch person who's looking out for any problems and ensuring that if there are any complications that do arise, you get the necessary referral to the next level of care, whether it is to the hospital with the gynae that specializes in looking after complicated pregnancies. Then your midwife will be sure to do that for you if things do not go as planned. But if things go well, then things can go well and you can deliver naturally. And then the 9th reason why you should choose a midwife is because I mentioned this in one of the points, is that a midwife believes in a woman's natural ability to give birth. A woman's body was built to give birth. It was designed to be able to give birth. Women are perfectly capable of delivering their babies by themselves naturally, and your midwife believes in that so much that your midwife will allow you to listen to your body. Even when the time to push comes, midwife will wait for your body to be ready to push, you know. Midwife will allow you to listen to your body, listen to the cues of your body, and just let everything happen naturally and let everything happen by itself. As long as the baby is fine and the baby is not distressed and mom is also good, then your midwife will give you that chance to be able to let things progress naturally, because she believes in your ability to give birth. So that's kind of an amazing thing, because you have someone who believes in you and who's vouching for you, who just wants you to do well and give birth to your baby in the way that you want. So that's really amazing. And then the last but not least reason why you should choose a midwife is because you will have a lifelong friend in your midwife. So if it's your first pregnancy and you go to your midwife and you guys have a great relationship throughout the whole pregnancy, you can still continue with your midwife in consecutive pregnancies, and even after you give birth you can still use your midwife with your baby, because your midwife can also do your immunizations. If your midwife is offering that service of giving immunizations and having a baby clinic, then you can continue with your midwife and she can just be with you as you raise your baby as well. So it's like a lifelong relationship, and it's really amazing, guys. It's like so amazing. It really takes a lot of pressure off of your shoulders, because you know you have someone you can trust to be with you throughout your pregnancies. So yeah, guys, those are the reasons, the 10 reasons why you should choose a midwife as your primary caregiver throughout your pregnancy. And I hope that you ladies are going to give these points a lot of thought, and I hope that it's going to motivate you to choose a midwife for your birth and your labor and your pregnancy. And just a reminder, guys, I'm an independent private midwife as well, and I have my practice, Miracle of Life Midwifery Services, and I do provide services for pregnant women, and I also do your labor and childbirth, and soon I will be able to do immunizations as well. Just waiting for the permits. Yeah, but yeah, guys, if you are looking for a midwife, I'm here. I can take you throughout your whole pregnancy, and let's build that relationship and let's go on the whole journey empowering each other as women. So yeah, guys, if you enjoyed this video, please do give it a thumbs up. Please subscribe to my channel and click on the notification bell so that you don't miss out whenever I post a video. And that's it for today's video, guys, and I cannot wait to see you on my next video. Bye.